Ms. Bertie Kukasnemi Leno, Councillor Delegator of the European Union to Malaysia, Dr. Tricia Yeo, Chief Executive Officer for the Institute of Democracy and Economic Affairs IDEAS Malaysia, Dr. Juwita Binti Mohamad, Director of Research of IDEAS Malaysia, distinguished speakers, distinguished guests, ladies and gentlemen, salam sejahtera and a very good morning to everyone. My name is Kurjane and I will be your moderator for today. Now, please allow me to begin with a short housekeeping announcement. At IDEAS, we are committed to providing a safe space for all parties, both internal and external, to work together. IDEAS has a policy of zero tolerance towards sexual exploitation and abuse. Everyone here today is responsible for making this event a safe space for public discourse. Please be reminded that this event is recorded and is broadcasted live on Facebook. During the Q&A session, you can submit your questions using the Q&A feature in Zoom. Ladies and gentlemen, welcome to IDEAS and UNICEF's webinar launch for our report titled Left Far Behind, the Impact of COVID-19 on the Access to Education and Healthcare for Refugee and Asylum-Seeking Children in Peninsular Malaysia. This report is a research study conducted under Protecting Children Affected by Migration in Southeast, South and Central Asia, a project implemented by UNICEF and IDEAS and supported by the European Union. Now to begin, may I invite Dr. Tricia Yeo, the Chief Executive Officer of IDEAS Malaysia, to deliver her welcoming remarks. Tricia, the floor is yours.
Thank you so much, Kurjane. And thank you to all of you for coming this morning, spending your Tuesday morning with us at this webinar event. Now, I'm very, very pleased and very proud of this research report that has taken a particularly lengthy period of time. This today is actually a culmination of a long journey of several years in which the project had several variations, accommodating as well the pandemic. So today's launch of the report, of course, we know is titled Left Far Behind, the Impacts of COVID-19 on Access to Education and Healthcare for Refugee and Asylum-Seeking Children in Peninsular Malaysia. We aim to assess in this report the impact of COVID-19 on refugee and asylum-seeking children's access to both education and healthcare in Malaysia, and identify evidence-based solutions to address these impacts. Before I go on, I'd like to thank a few partners that have come together to really make this happen. Firstly, I'd like to thank UNICEF, in particular Lee Soo-Ann, and all the team members for the journeying together. This has really been a really great experience. I'd like to thank as well Diab Consultancy and Wan Yashin, our researcher, as well as our internal team members at IDEAS, Gamaliel Khan, Lau Chen Ting, Vaishnavi Morgan Rao, Juwita Mohamad, and Kurjane Ngu for putting this whole report together. Of course, I have to thank the European Union for the support that they provided and the funding they provided to make this report happen. So as Kurjane pointed out, this report is actually part of a larger research study conducted under Protecting Children Affected by Migration in Southeast, South, and Central Asia. And this is a project implemented by UNICEF and IDEAS, and it's co-funded by the European Union and UNICEF. And the structure of the project and how it actually happened was that we had an inception phase from March 2021 to August 2021, during which we had the literature review, we developed the research methodology, questionnaire, and the study and ethical protocols. And there was an inception report as well that we emerged with. This was followed by the stage of primary data collection. And I'm sure the presenters will also go through this with you later. So during this time, we had a pilot study, a primary data collection, and the data analysis. So we interviewed and surveyed parents, teachers, adolescents, and healthcare workers across Peninsular Malaysia. And the final outputs, of course, the report is there on the screen, you can see it. And the thematic report is essentially a merged and synthesized version of two full study reports, each focusing respectively on education and healthcare. We're also excited to be able to disseminate some other materials after the report is launched, including an audiobook in the Rohingya language, which will disseminate it across the community. One element that we felt important was to be able to make sure that these materials reach the community themselves, and some infographics that will be disseminated across the community, as well as some media statements that will be coming out later on. So today's launch, I'm so pleased to have so many distinguished guests and speakers from so many different important institutions in Malaysia that have come together over many years to support and do work on this very important topic. But the launch today itself, we want to promote public discourse and advocacy on the issue of access to education and healthcare for refugees and asylum-seeking children. And we would like to provide a platform for relevant stakeholders to share their experiences and challenges faced by refugees and asylum-seeking children in accessing education and healthcare as a result of COVID-19 and beyond. I'll just go through some very brief background notes about what we understand as refugees and asylum seekers, and then I will pass the floor over. So do bear with me a little bit more. So we know that more than 25% of the refugees and asylum seekers registered with UNHCR in Malaysia are actually children below the age of 18, which means that some 47,200 children have limited or no access to education, healthcare, and other essential services due to their lack of legal status. And of course, this number is likely to be underestimated as well because it does not account for who are not documented. So there is a lack of a domestic, legislative, and administrative framework to protect refugees and asylum seekers in Malaysia, which puts these children amongst the most vulnerable groups in society, vulnerable to especially the impacts of COVID-19 and beyond. So I'll talk a bit about each of these areas. So in terms of education, we know that according to UNHCR, only 44% of refugee children in Malaysia are enrolled in primary education, and 16% of refugee youth are enrolled in secondary education. And prior to the pandemic, we know that these challenges were already there. They did not already have access to formal education as a result of circulars and policies that make it compulsory for education only for Malaysian citizens. And so this has left refugees and asylum seekers with access to only informal education through alternative learning centers, or ALCs. And you'll hear a lot about ALCs during the presentation today, because that's really where we had the support to do our surveys and interviews. And many of these barriers were already long in existence prior to the pandemic, which have worsened since we know that there's a lack of financial resources faced by these communities. There's a lack of awareness on the importance of education. There have been geographical barriers. And of course, most importantly, probably the lack of legal protection. In terms of healthcare, we also know that the process of migration itself already exposes refugee and asylum-seeking children to greater health risks, resulting in poorer health outcomes. So refugees and asylum seekers have access to NGO health facilities for primary care, but due to the lack of a legal framework, they have limited access to affordable secondary health care and emergency care. So many of these things that already pre-existed also worsened after the pandemic. Again, the same things, basically due to financial barriers, due to limited employment and movement, language barriers, the fears of arrest and detention. We saw this playing out a lot in the media, knowledge gaps on health literacy and health services, and the lack of state support for child protection issues, especially for refugee and asylum-seeking children. So I think the study basically highlighted that these barriers were exacerbated by the pandemic. And even though there were new challenges, I think we also see that the pandemic has presented new opportunities for these children to access education and healthcare services through new methods, online, modalities, digital tools, and so on. I think many of the NGOs actually drew on these opportunities to enable improved access, but also there were very real limitations and perhaps are not sustainable in the long run. In Malaysia, we know that Article 8 of the Federal Constitution sets out that all people are equal before the law and are entitled to the equal protection of the law. In this context, the core of Malaysian law describes the equal protection of the law for every person and not just citizens. Despite the large presence of refugees in the country, Malaysia is not yet a party to the 1951 Refugee Convention, and we still don't have any domestic or administrative frameworks that govern refugees and their rights. So because of this lack of legal rights, the refugees and asylum seekers do not have access to safe and decent employment, which ultimately limits their access to formal education and healthcare, and of course keeps them in this cycle of poverty. So ladies and gentlemen, friends and delegates from the international communities, I'd just like to close by saying that through this project, we hope that we've been able to shed some light and document through research the points that many of you may already know. We hope to emphasize that while we are moving out of the COVID-19 pandemic, or at least the worst stages of it, fundamental human rights issues faced by refugees and asylum seekers, such as accessing formal education and healthcare, remain critical and urgent. We need to adopt lessons learned as we recover and rebuild from the pandemic, knowing that if we don't use the opportunity to make changes, the consequences already are and will continue to be dire. We can begin by recognizing refugees and asylum seekers' legal status and formulating domestic legislative and administrative frameworks to ensure their rights are protected. And indeed, our report has many recommendations to that end. I hope that all of you can read that report. Finally, just to close, we must recognize that every child should be granted the access to safe and quality education. Every child should be given the opportunity to realize their potential, to live a dignified life, and that includes refugees and asylum-seeking children. After all, a final reminder for all of us is that the reality is that all of humanity were once migrants in search of better shores and livelihoods. And so we hope that all communities and government and the relevant agencies involved would keep this in mind as we think about policies that can shape the future for the benefit of refugees and asylum-seeking children in the country. Thank you very much for your time. Enjoy the day's proceedings, and I pass the time back to our able MC for the day, Kerjane.
Thank you so much, Dr. Trisha, for your welcoming remarks. Now, due to unforeseen circumstances, Christopher Davids, Deputy Representative Program of UNICEF, is unable to be with us here today to deliver his remarks. Hence, it's our honor to have Ms. Saskia Bloom, Officer in Charge, Deputy Representative Program of UNICEF Malaysia, to deliver her welcoming remarks.
Selamat pagi, a very good morning to all of you. A very good morning to Dr. Tricia Yeo, CEO of IDEAS Malaysia, our partner in this important report. Ms. VP Kukasniemi Leno, Councillor from the delegation of the European Union to Malaysia, Ms. Wan Yashin and Dr. Veena Pillai, who are the authors of the report, and our distinguished panelists. We have Mr. Keen Shum, Senior Protection Officer at UNHCR Malaysia, Mr. Yatu Huang, Refugee Community-Based Advocate and Youth Leader, Ms. Siti Naya Binti Muhammad Rusli, Assistant Secretary at the Office of the Children's Commissioner, Suakam, and Dr. Siti Noraida Binti Muhammad Habibullah, Founder and Medical Director of the Clinic Amal Moyahir and Senior Lecturer at Monash University, Malaysia. Colleagues, members of the media, esteemed guests, and all who have joined us here today on Zoom or Facebook Live. I am delighted to welcome you all today to the launch of the report, Left Far Behind, the impact of COVID-19 on access to education and healthcare for refugee and asylum-seeking children in Peninsular Malaysia. This report really is the culmination of the partnership between IDEAS and UNICEF over the past 2 years, and we would like to really express our sincere thanks and appreciation to IDEAS for this collaboration that brought this report to fruition in the midst of the challenges of the pandemic. And of course, we would also like to thank the European Union for their invaluable support to UNICEF's work overall under the Protecting Children Affected by Migration in South, East, South, and Central Asia cross-regional program. And of course, without which the study would not have been possible. But first and foremost, we wish to extend our deep appreciation to the refugee community, including children, parents, teachers, healthcare workers, and interpreters, for sharing their stories and experiences with us, who are the central voices of the report and why we are gathered here today. The right to education and healthcare are two of the most fundamental rights of a child. Access to quality education and healthcare are essential building blocks for a child's ability to survive and thrive and to develop to their fullest potential. The right of a child to these most essential of services, education and healthcare, is clearly recognized in the Convention on the Rights of the Child, which is the most widely ratified treaty in the world, has been ratified by most countries, including Malaysia. And this is also recognized in the 2030 Agenda for Sustainable Development, where member states, including Malaysia, have committed to leaving no one behind. There's SDG 3 on good health and well-being for all at all ages, and SDG 4 on inclusive education for all. But not every child in Malaysia gets to enjoy the right to learn and to enjoy the right for healthcare. There are more than 180,000 refugees and asylum seekers registered with UNHCR in Malaysia, out of which more than 25% are children under the age of 18. And as we will hear from the authors of the report and our esteemed panelists today, the impact of COVID-19 has resulted in more than 47,000 refugee children being left even further behind than before the pandemic. We now see a light at the end of the tunnel, as WHO Director General recently indicated, and we are more optimistic that Malaysia and other countries we're making our way out of the pandemic. For many, life is beginning to look a little bit like before the pandemic, a little bit more normal. But for refugee children, the situation is far from improved. The impact of COVID-19, if not addressed urgently, is likely to continue bringing long-term harm to their lives. That is why this report is so relevant and critical, and why the panel discussion today is so important. We must make sure that the light at the end of the tunnel shines for all. So the report outlines lessons learned during the pandemic and provides concrete recommendations to address the barriers and leverage also on new opportunities to increase access to education and healthcare. And importantly, this is drawn from refugees, children, and parents themselves, as well as the teachers and healthcare workers that support them. And during the panel, we will hear more from the lived realities and perspectives of experts and practitioners themselves. A refugee community advocate, a refugee healthcare worker, UNHCR Malaysia, and Suakam. As we launch this report today, this is the question we must consider. What can we do together to ensure refugee children in Malaysia Malaysia can go to school in safety and thrive in health and well-being. So let us work together to ensure that refugee children in Malaysia are able to access the building blocks that they need to reach a better future. They have been left far behind far too long. So thank you all again for joining the launch today. I wish you all a very productive and meaningful panel discussion. Thank you.
Thank you, Ms. Hatskiablu. Now I would like to welcome Ms. Verpi Kukasnemi Leno, Consular Delegation of the European Union to Malaysia, to deliver her keynote address. Ms. Verpi, the floor is yours.
Thank you, Kiliane. Dr. Tricia Yeo, Chief Executive of IDEAS Malaysia, Ms. Saskia Blum, Chief of Child Protection UNICEF, Ms. Chuita Binti Mohammed, Director of Research, IDEAS Malaysia, civil society organizations, partners, colleagues, everyone joining us today, a very warm welcome. It is a great pleasure for me to be here to speak at the launching event of the report, The Impact of COVID-19 on Access to Education for Refugee and Asylum-Seeking Children in Peninsular Malaysia. First of all, let me congratulate IDEAS and UNICEF for conducting this very important and timely study. 2 years of the COVID-19 pandemic have led to far-reaching consequences around the world. In addition to the public health emergency, the pandemic's restrictions caused a major education crisis. As we heard in the recent Transforming Education Summit convened in New York this month, the world was already facing a learning crisis before the pandemic, but the pandemic has made a bad situation much worse. Half of the world's refugee children are out of school. In Malaysia, where refugee children have no access to formal education, this number is even lower. Ladies and gentlemen, the EU has reacted swiftly to the COVID-19 pandemic throughout the world, including in Malaysia. Several projects have been adapted to better respond to the challenges brought about by the pandemic. In Malaysia, there are 13 EU-funded projects currently implemented by civil society organizations and human rights organizations. Most projects have contributed to the COVID-19 response by adapting activities with interventions focusing on gender equality, media, indigenous people, and human rights. Furthermore, Malaysia is currently benefiting from a number of regional and multi-country interventions, of which protecting children affected by migration in Southeast, South and Central Asia, a program implemented by UNICEF and co-founded by UNICEF and the European Union, is a great example. In the framework of the Southeast Asia Health Pandemic Response and Preparedness Program implemented by the WHO, several activities were also conducted to strengthen health systems and to support the COVID-19 response. More generally, in Asia and throughout the world, the EU has supported several interventions in response to the COVID-19 pandemic. These interventions focused on access to health, access to education, access to justice, and more generally, access to services, even during COVID-19. The EU focuses on communities and has a particular attention for vulnerable groups, such as migrants or children. Therefore, this project on children affected by migration is a good example of project at the intersection of EU priorities. Ladies and gentlemen, as we look to build back better and recover from the pandemic in Malaysia and throughout the world, the report is an important and timely publication, grounded in evidence, views, and recommendations gathered from the refugee community themselves. Let me highlight some key points from the report. As Tricia already mentioned, Malaysia is not a party to the 1951 Refugee Convention and has no domestic or administrative framework that governs refugees and their rights. Given the lack of legal status, refugees and asylum seekers do not have access to safe and decent formal employment, which ultimately limits their access to formal education and healthcare. More than 25% of the refugee and asylum seekers registered with UNHCR in Malaysia are children below the age of 18. So this means that some 47,200 children have limited or no access to education, healthcare, and other essential services due to the lack of their legal status. This number is likely underestimated as it doesn't account for those who are not documented at all. The lack of a domestic legal framework to protect refugees and asylum seekers in Malaysia puts these children amongst the most vulnerable groups in society to impact of COVID-19. While disruptions in accessing education and healthcare have been experienced globally as the world charts its way out of pandemic, COVID-19 has disproportionately impacted marginalized populations such as refugees and asylum seekers. Ladies and gentlemen, according to UNHCR, only 44% of refugee children in Malaysia are enrolled in primary education, and 16% of refugee youth are enrolled in secondary education. Prior to the pandemic, refugee and asylum-seeking children already didn't have the right to formal education, as existing circulars and policies to make primary education compulsory or inclusive only apply to children with one or both parents who are Malaysian citizens. This leaves them with access to only informal education through alternative learning centers, which comes with various barriers and challenges faced by the children as well as the ALCs themselves, limiting access to education. Many of these barriers that existed before the pandemic have even worsened. These are barriers such as the lack of financial resources faced by refugee and asylum-seeking families, a lack of awareness of the importance of education, geographical barriers, and lack of legal protection. The other topic covered by this study was refugees' access to health. Research has shown that the progress of migration itself already exposes refugee and asylum-seeking children to greater health risk, resulting in poorer health outcomes. Refugee and asylum seekers in Malaysia have access to NGO health facilities for primary care, but due to the lack of legal framework, they have limited access to affordable secondary healthcare and emergency care. Many of these barriers that existed before the pandemic have worsened, such as financial barriers due to limited employment and movement, language barriers, fear of arrest and detention, knowledge gaps on health literacy and health services, and lack of state support for child protection issues, especially for refugee and asylum-seeking children. This report demonstrates that while these barriers existed before the pandemic, most of these barriers have been compounded as a result of the effects and consequences of COVID-19. Within this group of refugee children, girls and children with disabilities face additional challenges in accessing services. The report also shows that while the pandemic presented some opportunities for refugee and asylum-seeking children to access education and healthcare services through new partnerships and the use of devices and online technology for learning, these were few and far between compared to the increased challenges and new losses faced by the marginalized group. The urgency is clear. We owe it to these most vulnerable children to act now or risk them bearing the cost of this pandemic for the rest of their lives. Some imperatives can be drawn from the report. In order for systemic change to happen, refugee and asylum-seeking children must be included in national policies that protect and uphold their rights to education and healthcare in line with the UN Convention of the Rights of the Child. Collaboration and partnership between all stakeholders is critical in order to implement policies and programs that will increase and expand access to education and healthcare for refugee and asylum-seeking children in Malaysia. Now, more than ever, a child's status should not be a barrier to accessing essential services. All children deserve opportunities to learn and grow. When they are able to access quality education and healthcare, refugee children can survive and thrive, even far from their home. I would like to conclude by emphasizing that all children, irrespective of their migration or refugee status, are first and foremost children who are entitled to all their rights enshrined in the UN Convention on the Rights of the Child, and that their best interest must be the primary consideration of all decisions and actions concerning them. I am proud that the European Union has been able to support this important study, and I look forward to hear the discussions today. Thank you. Terima kasih.
Thank you so much, Ms. Verpi, for your keynote address. And now we will officially launch this report, and I would like to invite Ms. Wan Yashin and Dr. Juwita binti Muhammad to present the key findings from this report. Over to you.
Thank you, Kajin. Okay, let me share my screen and slides with you. Good morning, everyone. I'm very happy to share with you the findings of this study. So before I start, firstly, I would like to thank EU for their support of this project, and of course of UNICEF and IDEAS for implementing this project. It has been a journey, and I also like to thank the research team, UNICEF team, and also teachers, parents, adolescents, healthcare workers whom we have interviewed, and they have provided so much insights to us, reviewers and all who have contributed to this project in one way or another. Thank you to all, because without your support and without your inputs, this project will not come to pass. Yeah, so just to start off, my focus in this study is on education, while my co-authors focus on healthcare. So I will present on the findings of the impact of COVID-19 to access education for refugee and asylum-seeking children, while my colleague, Dr. Juwita, will continue with the findings on impact of COVID-19 to the access of healthcare. So I think the speakers before this have presented a very good overview and background of the refugees community in Malaysia and also what has happened during COVID-19. And I will just briefly go through it. So end of June 2022, we have around 184,080 refugees and asylum seekers in Malaysia, registered with UNHCR in Malaysia. So among these refugees, there are 47,200 children, so approximately 25% of them are children. And they mainly reside in Klang Valley, which comprise of Selangor, Kuala Lumpur, and Putrajaya, and hosts the highest number of refugee and asylum seekers, followed by Penang, then Johor, and Kedah. So as it was mentioned, Malaysia has yet to ratify the 1951 Refugee Convention and its 1967 protocol. Thus, the country lacks a legislative and administrative framework to protect refugees and asylum seekers within its territory. So this results in their lack of access to basic rights, such as freedom of movement, legal employment, formal education, and affordable healthcare. So the objective of the study is to identify and understand the barriers and opportunities faced by refugee and asylum-seeking children in Malaysia in accessing education and healthcare due to the COVID-19 pandemic. And the second objective is to understand how these barriers to and opportunities have been exacerbated or improved for refugee and asylum-seeking children based on age, gender, ethnicity, location, and disability. So the method that we use is a mixed method design, using quantitative online question and qualitative in-depth telephone interviews. So we have interviewed teachers, parents, adolescents, and also healthcare workers from various states across Peninsular Malaysia. So the research was done between November 2021 and January 2022. So this thematic report that we launched today is a merged and concise version of two full study reports, so each focusing on education and healthcare. So now I will go into findings of access to education. So we see that in 2021, only 36% of refugee children in Malaysia are enrolled in primary education.
So sorry to interrupt. We can't really see your slides.
Okay.
Yeah. Thank you so much.
All right, let me try again. Okay. Okay. Can you see it now?
Yes, we can see it.
All right. Okay. So in 2022, the percentage have increased for primary enrollment to 44%, but decreased for secondary enrollment to 16%. So we can see that the percentages of enrollment in primary education, although has increased, but in terms of the absolute number has decreased from 6,000 to 5,000. And for secondary education, it has decreased in terms of percentage and also the number. So refugee and asylum-seeking children have great challenges in accessing formal education in Malaysia. Although the principle of non-discrimination is enshrined in the Federal Constitution of Malaysia, refugee and asylum-seeking children are continued to be denied access to national schools. So they could only receive informal education through alternative learning centers. So as of September 2021, at the time that we started planning for the study, there are 127 ALCs in Peninsular Malaysia, and only 21 offers secondary level education. So in terms of the profile of the respondents that we have interviewed, the online questionnaire was sent out to 127 ALCs, with 50 of the ALCs agreeing to participate. And the majority of the ALCs are located in Selangor and Kuala Lumpur, and they are students originated from 16 countries, including Myanmar, Afghanistan, Somalia, and others. So the in-depth interviews with teachers, we have interviewed 8 teachers. They represented their respective ALCs, and the ALCs are located in Selangor, Pahang, Kelantan, Penang, Kuala Lumpur, and Johor. And we have also interviewed 9 pair of parents and adolescents. So we have, out of the 9 pair, there are 4 girls and 5 boys, and including school-going and out-of-school children. One adolescent we have interviewed has learning disabilities, and they reside in Penang, Pahang, Selangor, Johor, and KL. So in terms of the barriers, like what we have found is poverty and livelihoods is the main barrier to education that teachers have attributed. So if you look at the graph, out of the 100% of teachers that have responded to the online survey, 46% said that poverty and lack of financial resources is the main barrier. And the second highest reported barrier, which is burden of earning a livelihood, is 20%, is also related to the poverty. So interviews with parents and teachers reveal that parents have difficulties in financing their children's education, as they could not afford tuition fees and other related expenses. So as refugee asylum-seeking parents do not have the formal right to work, most of them are daily wage earners without stable and consistent incomes. Although tuition fees are subsidized, most of the ALCs subsidize tuition fees. Transportation could be an additional financial burden that is unaffordable for parents. So the poor financial condition of refugee and asylum-seeking families resulted in students dropping out of school to work. So one of the teachers shared that there are boys who stop schooling around 15 or 16 years old to support their families. So what we have learned that during the COVID-19 pandemic, livelihood has been greatly impacted. Some of the parents lost their jobs during the MCO, which is the movement control order, and they have to prioritize food over education. However, on a positive side is that once the post-MCO, the condition has become better when the economy will open and parents are able to work again. So the second barrier that we have identified is the lack of awareness of the importance of education. So on the online questionnaire we have sent to the teachers, so this is reported by the teachers that 10% of the teachers stated that is the main barrier. So although awareness of the importance of education has increased throughout the years, it's still one of the main barriers, but it has reported improvement throughout the year. So from the interviews with teachers, it was found that certain communities place a higher value of livelihoods over education, and we can understand due to their situation. There is an increase in awareness of the importance of education among parents during the COVID-19. So we can see that what has happened is that from interviews with teachers, they have said that and shared with us that some parents have recognized the need to be able to read and write. So when they have to register on My Sejahtera app during the pandemic, they realized that it is important to be able to read and write. So another possible explanation is that the aid and homework distribution during the pandemic has turned into opportunities to reach out and raise awareness of the importance of education. So the next barrier that we have identified is the distance to the nearest ALCs. Although only 6% of teachers indicated that is the main barrier, but it is a very major determinant for children who could not go to school. So from the interviews, we understand that most of the children that are not going to school that we have interviewed reside out of Clyde Valley, and they are more likely to be deprived of education due to the lack of available ELCs near their residences. So 2 out of the 4 out-of-school adolescents interviewed reported that they do not attend a school. So one of them is based in Penang and the other one in Pahang. So the adolescent in Penang tried to register in a national school but was denied, while the adolescent in Pahang could not find a school nearby. So during the COVID-19 pandemic, when the ALC shifted to online learning, this has created a new opportunity to bring education to children who are living far away from ALCs. So despite being far away, they could access the classes. So the next barrier that we see is in terms of security concerns and fear of detention. From what we have understand, the fear of arrest, detention, and security concerns are more prevalent when children are out of school and in older children. And the findings from the online questionnaire show that 4% of the teachers attributed it as a main barrier. And during the COVID-19 pandemic, the rise of xenophobia against the Rohingya community has affected the safety of children when they leave their schools. When they leave their homes. So a teacher shared instances where the children were threatened and sometimes boys get into fights and girls are being teased when they are outside. So the next point is on lack of documentation. Out of the 4 interviewed adolescents out of school, 1 girl and 1 boy reported that they could not register in a school due to lack of documentation. And this not only impedes their access to education, but also to work at higher education in the future. So the next key finding, we found that girls are more likely to drop out due to carrying responsibilities as compared to boys because of the social cultural values of the communities. And online learning has also expanded the opportunity for children who cannot go to school due to carrying responsibilities. So this is one of the opportunities that we have identified. Refugee asylum-seeking adolescents have limited opportunities for academic progression to higher education. So even if they have completed their secondary education, many still could not access higher education due to documentation, financial, or even certification problems. So what we have seen so far is in terms of access to education. The following is questions that we ask the teachers in terms of provision of education. What are the challenges that they face in providing education? So the main challenge that is identified is the lack of financial resources, which affects the operation, the quality of teaching, learning environment for refugee asylum-seeking children. So 74% of teachers think that a lack of financial resources is a challenge to the provision of education, which is the highest among all the listed challenges. All interviewed teachers are reported that their ALCs have funding constraints for the operations and provision of education. And the COVID-19 pandemic has affected the income of ALCs because of the reduction, of the reduction in tuition fee, another in the change of funding from donors. So we find that donors have reduced in terms of monetary funding and increased in terms of food, aid, and also learning devices. So the second challenge that was highlighted is the lack of teaching materials and equipment, which is also due to limited financial resources. So during the initial period of MCO, as ALCs shifted to online learning, the main challenge was the lack of devices and a stable internet connection. But this was significantly resolved when UNHCR and partner foundation distributed devices with internet access for children to access online learning. However, there are still some challenges that persist. So firstly, not all students received tablets and priority was given to older exam-year students. Secondly, some parents could not afford to top up their internet. And thirdly, the unstable internet connectivity has disrupted learning. Nevertheless, a positive outcome of the shift to online learning has expedited use of technology in teaching and learning. Teachers become more tech-savvy and learned to leverage online education materials, digital education tools, and platforms for teaching and upskilling. So post-MCO, when learning shifted back to physical, the existing challenges still persist. The next challenge that was identified is the lack of suitable environment to conduct classes. So many of the ALCs operated in buildings that are not conducive for teaching and learning due to financial constraints. So one of the teachers shared that his ALC, which occupies four floors of 2 shop lots, is overcrowded with an enrollment of around 250 students. And during the COVID-19 pandemic, from the interviews, we understand from parents and adolescents who have attended online classes, they shared a similar sentiment that online learning is less conducive to learning than physical classes. And they also have the challenge of having a conducive space at home to have online learning. And also the problem of insufficient supply of qualified teachers. Most of the interviewed teachers highlighted that hiring good quality and committed teachers is a major challenge for them. And one of the key reasons is that because they are unable to provide a competitive salary for teachers with the required qualifications. Besides that, it is difficult to find committed volunteers who can commit to teaching regularly and provide good quality teaching. So what happened during the pandemic is that there's a reduction in funding, which have resulted in a shortage of teachers. And as ALCs lack the financial resources to continue employing full-time teachers, some relied on volunteer teachers instead. So when classes were shifted online, teachers found it hard to adapt to online teaching initially, and ALCs had to train their teachers to teach online, which initially presented a huge challenge, but slowly as they adapt to it, it has turned into a new opportunity where the teachers become more tech savvy. So, and one of the opportunities that was identified is that because of the online classes and also shifting to online, they are able to access volunteers from other countries such as Singapore and the Philippines. So this study also looks from the perspective of gender, how barriers to education affects boys and girls differently. So we found that at the age of around 15 to 16 years old, many girls drop out due to carrying responsibilities and early marriage, while boys drop out to earn a livelihood to support their families. This is also consistent with the previous studies. So refugee asylum-seeking girls face compounded barriers due to their gender and refugee status. However, there are new opportunities due to online learning that mentioned before, that children with carrying responsibilities can attend school online. So we see that girls who have reached puberty and age and face societal pressure to be at home could continue their education online. Another opportunity which resulted from online learning and the distribution of tablets is connecting the children to teachers throughout the day. So this created an additional protective mechanism for refugee children, particularly girls. In terms of disabilities, children with disabilities could not access education due to the lack of available ALCs that cater to their needs. So from the survey, 89% of respondents said that there are additional challenges faced by children with disabilities. So these challenges include teachers not being trained to teach children with disabilities, a lack of appropriate teaching materials, a lack of access to assistive technology, a lack of accessibility to school buildings, and a lack of adequate intervention and rehabilitation service available. So although 20% of the student respondents to the online questionnaire identified that online learning is not accessible to children with disabilities, 8% indicated that it has enabled children with physical disabilities to access education. So online learning has impacted children with disabilities differently, and we need to recognize that not all disabilities are the same. So some of the recommendations, I think the speakers have also mentioned, and to clarify, there are some recommendations which are not new. Some are already implemented, but and also there are some recommendations from the respondents whom we have interviewed. So the first is to create pathways to academic or vocational certification for refugee and asylum-seeking children. The second is to allow refugee and asylum-seeking children to participate in the Malaysia Certificate of Education Examination, or SPM. And then there is a need to increase access to registration with UNHCR, for example, through mobile registration stations in different regions. And I understand there is already a mobile registration provided by UNHCR. So there is need to foster collaboration on fundraising activities among ALCs to help raise awareness of the needs of refugee and asylum-seeking children. Then there also need to provide support to ALCs to meet the criteria for registering with the Ministry of Education. This will also ensure that ALCs improve and maintain the quality of teaching and learning, as well as increase the confidence of funders and could be able to generate more funds. And the next is to provide capacity building to upskill teachers in terms of teaching and learning, and also child protection. So in terms of targeted programs on raising awareness and demand for education, suggest to provide financial aid and assistance, such as direct cash transfer linked to education, scholarships and grants, to promote access and attendance and participation in schools. Because as poverty is one of the main barriers, this will greatly mitigate and help them to overcome this challenge. The next is to advocate and increase the awareness of the importance of education among refugee and asylum-seeking parents and children. We see some results that have been done by some teachers and others who are working with them. So the next is on conducting gender transformative positive parenting interventions with parents as well as the communities to change the social cultural values in terms of harmful gender norms. Then we need to expand partnerships and coordination between ALCs and community leaders. So some teachers have suggested how they can partner with the community leaders to reach out to students and establish local community schools. The next recommendation is on strengthening networks and connection between ALCs and donors to mobilize financial resources and support, engage with industry actors and the private sector to connect refugee and asylum-seeking students to internship opportunities. And that is the end of my presentation on access to education. Now I pass over to Dr. Joita.
Thank you so much, Yashin. I'm so happy to be here to be presenting the next section on behalf of the authors. I'm Juwita Mohammed. I'm here from IDEAS. I will now share the screen. I think I'm having a bit of a difficulty sharing the slides. Kirjane, is it possible for you to share it from your side?
Yep.
Thank you. So as mentioned before, I will be presenting the healthcare component of this report. Next slide, please. The report or the section on healthcare looks into the primary care and also the secondary care of the availability of healthcare for refugees and also asylum seekers. So as a background for primary care, refugees and asylum seekers are able to go to health facilities that are created and supported by NGOs. They're able to seek support from private clinics as well as government-run clinics as well as hospitals. For the secondary care, refugees and asylum seekers are able to tap into the support provided by private hospitals as well as government hospitals. Next slide, please. So as an introduction, the report highlighted that the process of migration exposes refugee and also asylum-seeking children to greater health risks, and this again results in poorer health outcomes in general. Looking at previous studies, there are already several barriers that have been identified. So the first one is the poor health literacy and the general lack of health information. Language barriers is also an important determinant of healthcare access. Fear due to lack of legal status or documentation is also an important determinant. Cost-related barriers is also included. Lack of appropriate services that can cater to the trauma and needs, as well as stigma and harassments, are all different factors that contribute to these barriers to healthcare, access to healthcare. So from the study, there are about 40 different participants, all healthcare workers. 30 healthcare workers completed the online survey, and 10 healthcare workers participated in the in-depth structured interviews. So from the figures here, you can see that most of the healthcare workers are doctors and also nurses, while the localities of these surveyed and interviewed health care workers are located mostly in Klang Valley, in KL, and also in Selangor. Next slide, please. So from the report, these are the key findings. The nature of presentations have remained unchanged since the beginning of the pandemic. The common primary care presentations among refugee children as well as asylum-seeking children are fever, upper respiratory tract symptoms, and also worms for both boys and girls. But looking at girls specifically, the main health conditions that affected girls arises from issues related to child marriages, teenage pregnancies, child abuse, and also sexual and gender-based violence. For boys, the main health conditions reported were skin issues. For children with disabilities, malnutrition was reported as one of the top 3 presentations. Next slide, please. So the report also highlighted the causes of morbidity. The main causes of morbidity, especially during the pandemic, was linked to lack of health literacy, hygiene status, poor nutrition, and of course, lack of documentation. So the participants perceive causes of morbidity actually worsened during the pandemic. And this is again going to be presented in a diagram, the next slide. Participants actually also reported of an increase for demand for mental health services, child protection and care services for survivors of sexual and gender-based violence, particularly after MCO. So social determinants of health also included socioeconomic conditions, safe living and also working conditions, access to livelihoods perceived to have been negatively linked or impacted since the beginning of the pandemic. Next slide, please. So again, here, the respondents perceived major causes of morbidity among refugee and also asylum-seeking children. And we see here a lack of health literacy of caregivers to be one of the main major causes or perceived causes. Again, this is also highlighted by hygiene status of about 25%, and followed by lack of documentation and legal status. And what this figure shows is actually the green bar, which highlights the perceived major causes that has worsened due to these different factors. Next slide, please. So the report highlighted a few barriers to access to healthcare. Number one is cost-related. It was found that all existing barriers to access actually worsened during the pandemic. So some more information about the cost-related barriers. So the participants described this as a major and primary barrier to access to healthcare. So these costs include costs for care, such as transportation, interpretation, testing and investigations, treatment and so admissions, multiple follow-ups, and also multiple visits. So access to antenatal care, secondary care, and also childhood vaccinations is also quite limited due to the high costs, relatively high costs. The policy introduced in 2016 by the government of Malaysia, which stated that the fees were to be increased for foreign patients, further increased as well this barrier, this cost-related barrier. So during the COVID-19 and the MCO, it has led to the worsening and also unstable financial situation because there were evictions, a lack of access of food, rates, and also continuous arrests exacerbated this cost. Next slide, please. The second barrier is social cultural. So from the survey and also from the structured interviews undergone, the healthcare workers perceived cultural and language barriers to be the top two main social cultural barriers. To date, there's, for now, or during the pandemic, there were no legal options to hire interpreters from refugee communities. So there were no interpretation services in government services. There's lack of social cultural sensitization in NGOs and also government facilities. 63% of the respondents reported that there was no appropriate child-friendly language in health promotion activities. So without case management services or interpretation support, the children would struggle to access government healthcare systems, especially during the pandemic, because there was the 1 person per consultation policy introduced then. Next slide, please. The third barrier is the fear of arrest. So 90% of the surveyed participants reported that a lack of documentation and also fear of arrest and detention is seen as a major barrier. These are linked to xenophobia and also health policies, such as Circular number 10, introduced by the Ministry of Health. So being undocumented often led to the mistreatment and discrimination at different health facilities, and it also led to delays in seeking healthcare. So there's also this compounding barrier of higher costs. The groups were unable to access the 50% discount of treatments and also services. Next slide, please. The fourth barrier is the harmful policies that are in place. So as mentioned before, Circular number 10 or the existence of Circular number 10 increases the fear among the group, the refugees and also asylum-seeking children, and it acts as a deterrent for many to seek healthcare unless absolutely necessary. So there is an ethical implications for physicians. It is in conflict with the motto of do no harm. So in 2016, there was a fee increase policy and policy as well on limiting medication to up to 5 days. So again, this exacerbated the cost barriers and impedes quality or higher quality of treatment. The inconsistency in application of these policies would mean that policy on free treatment and investigations for infectious diseases will also be affected. Next slide, please. Barrier number 5 would be discrimination. So according to the healthcare workers that were sampled, there is apparent discrimination in both government and NGO healthcare facilities. Participants also reported cases of refugees being denied treatment or even rejected at hospitals due to their status. The discrimination and xenophobia are presented in the forms of, again, refusal to provide treatment, suggesting they attend private facilities instead, and practices that results in humiliation and also embarrassment. So these barriers are worsened by the pandemic, where again, we can see rising hate speech occurrences as well as targeted xenophobia against refugee communities on the ground. Next slide, please. Barrier number 6 is the knowledge gap. So limited health literacy, a lack of information on health services, as well as inadequate parenting skills sum up the main barriers to knowledge gaps. 80% of survey respondents reported poor health literacy as a barrier to access. Why is this so? This is because of social barriers such as language barriers. Migration experience actually led to displacements and separations from families. Prevalence of child marriages and young mothers are also unable to absorb and understand health knowledge in the current context. So again, there are knowledge gaps. These knowledge gaps have directly contributed to some of the common health conditions like accidents and also trauma cases, neglect, and also primary healthcare issues. Next slide, please. Barrier number 7 is the availability of the services. So the lack of state support, it was found that the lack of state support for child protection issues and also availability of refugee-specific health services is quite apparent. Participants reported that in many cases, the social welfare department did not intervene in cases of child abuse or child neglect, child marriage, and child and teenage pregnancies, cases involving foreign children. These are due to factors such as the incorrect understanding and application of the Child Act of 2001, limited number of child protection personnel and shelters on the ground, limited understanding of the consequences of child marriage, and also its relations to child protection. So to date, or during the time of observation, too few NGOs clinics cater to the refugee population. There's a lack of support for services beyond basic healthcare services, and there is obviously a lack of available services for complex medical cases. Next slide, please. So the study has put in place the differences and barriers according to different factors. So on gender and access to healthcare, the study reported that girls are disproportionately affected due to the effects of sexual and gender-based violence and early pregnancy. Teenage sons of mothers who were also survivors of domestic violence face a lack of protective placement. So again, within these identified gaps, there are opportunities for gender transformative, family-friendly, and family-centered approach in protection policies, which includes protection for both boys and also girls. Next slide, please. On disability and access to healthcare, of course, there are many differences or many gaps in the barriers, and there are also many opportunities, but I'm going to highlight the first one in this pillar. So most NGO refugee health clinics reported not being able to provide assistance for children outside of referrals to government facilities. And again, with this, there is an opportunity to increase the capacity of personnel at health facilities to identify and also address the needs of different groups of children, best practice guidelines, and also checklists for all health service providing care can be a good way to address these barriers. Next slide, please. So again, as I mentioned, there are opportunities to increase access to healthcare for refugee children and also asylum-seeking children. So these opportunities include outreach services, diversifying existing services, case management services, health promotion activities, strengthening community support, as well as new partnerships and also engagements. Next slide, please. The authors and also the report highlighted different buckets of recommendations. The first one is on legal and policy. So there is a need to remove or reduce non-citizen fees at government hospitals as this is evident from the findings and the case studies from within the report. There is a strong need to remove the Ministry of Health Circular number 10, and there needs to be an application of the Child Act and the UNCRC, UNCRPD, and the CEDAW to all children, whether they're foreign or local children. Next slide, please. The second bucket of recommendations is focused on the quality of healthcare services and capacity building. There is a need to provide capacity building for healthcare workers, especially in the areas of child marriage, child protection, sexual and gender-based violence, as well as mental health, so that they can identify and refer the cases appropriately. Among other recommendations under this pillar, there also needs to be an establishment of guidelines and best practices for NGO refugee clinics to meet gender and disability needs. Next slide, please. The third bucket is on targeted health programs for specific needs. So there needs to be an establishment of case management programs within the existing healthcare facilities that are open to all children and that can be supported by interpreting services. There also needs to be tailored programs for newly arrived and also arrived unaccompanied or separated children to improve health literacy and access to healthcare. And there needs to be a program that ensures refugees are involved through all of the phases of the design of these programs, implementation and evaluation of services, so that capacity, agency, rights, and also the dignities of refugees are at the center of these programs. Next slide, please. So this bucket of recommendation focuses on networking, coordination, and also partnership. The report and also the authors recommended for different parties to continue to strengthen partnerships and also coordination between refugee-specific healthcare service providers and healthcare workers in the public and private spheres, to continue sharing educational resources, referral options, as well as establish a support network, among other recommendations under this pillar. Next slide, please. So as a conclusion, we have seen that there are several significant numbers of barriers. The pandemic and also the civil society response allowed the NGOs to attempt to utilize some opportunities to enable improved access to healthcare. But as we can see, many of these had limitations and may not be sustainable to fully realize the rights to healthcare for these vulnerable groups. So the authors also encourage looking into implementing proposed recommendations from the study to again fully realize refugee and also asylum-seeking children's basic rights to access adequate and also affordable healthcare. Next slide, please. I will leave you with this case study that came about from one of the structured interviews. So again, the impact of the pandemic was very negative, and that there needs to be work done to improve the access to healthcare for refugees and also asylum-seeking children for the medium to long term. Thank you.
Thank you, Yashin, and thank you, Dr. Churita. So now we will go into a session where we will invite our panelists for a panel discussion. Before proceeding to the panel discussion, please allow me to remind you that if you have any questions about the report or any questions about the issue of refugee and asylum-seeking children's access to education and healthcare, please drop your questions in the Q&A function in Zoom. And we will try to address your questions at the end of the panel discussion. Now, before proceeding, please allow me to also introduce our panelists for today. So first up, we have Mr. Jaw De Kong Paude. Mr. Jaw is a refugee community-based advocate and youth leader, as well as writer, activist, and teacher. Mr. Jaw is from the Kachin state of Myanmar and is currently pursuing a law degree in Malaysia. Next, we have Mr. Keen Shum. Mr. Keen is a Senior Protection Officer of UNHCR, and prior to coming to Malaysia, he was the Senior Policy Officer for the Myanmar situation at the UNHCR Regional Bureau for Asia and the Pacific in Bangkok, Thailand. Next, we have Ms. Siti Najeha binti Muhammad Rusfi. Ms. Najeha is the Assistant Secretary of the Office of the Children's Commissioner, OCC, of Suhaka. Ms. Najeha is a qualified advocate and solicitor and has been active in child rights research. Last but not least, we have Dr. Siti Nuraida binti Muhammad Habibullah. Dr. Aida is a medical doctor as well as a senior lecturer at the Jeffrey Chia School of Medicine and Health Sciences, Monash University. Dr. Aida is currently pursuing a master's in global migration and social justice. And in 2019, amid the pandemic, she founded Clinic Amal Muhajir, a charity refugee clinic in the heart of Kuala Lumpur to cater for the medical needs of numerous refugees in Klang Valley. Now, thank you all for being here today, distinguished panelists. I will now kickstart the panel discussion by addressing the first question to Mr. Jaw. Now, Mr. Jaw, as a teacher at an ALC and as a refugee yourself, can you share with us what are some of the main struggles that you and your community face during the COVID-19 pandemic in terms of accessing education and healthcare, and how did you cope with it?
Thank you so much, Karjay, first of all, for the brief introductions. Because of the time limitations, I will go straight forward. So when it comes to the refugee education, parents education, during the pandemic, yeah, we struggle a lot, and we did not able to conduct the classes in person, as we all know, due to the MCO. So we do not have the resources, and then to migrate from the in-person classes to online classes. It was not easy. It was a lot of challenges we had to take over to migrate from the in-person classes to online classes due to a lack of technical expertise within our community and within our learning centers. And what we can see that is a few learning centers, not only a few, some learning centers have to hold their services for more than months, some even years. I also can observe here from my learning center, and more than 30% of students drop off during the pandemic, and because their parents cannot afford to get the devices for them, and then to top up the internet monthly, because they do not have a job. They lost their job during the pandemic, so they really couldn't keep up with what they're supposed to support their children. So that's why, unfortunately, especially the teenage age, older teenager, I would say that from 16 to 18, between that age, they drop off from the school. And during the pandemics, as we all know, that the infections rates among the refugees higher than the others. Population, because they have to live in very crowded places and have to share one family households with another family households, things like that. So because of the living conditions, and then the healthcare systems, and the outbreaks is like become a hotspot in the refugee community area as well. So the adults could not able to walk because of the virus, the outbreaks, and then the teenage have to step up to support their family, and they drop off from school and they're trying to find the available job. Let's say like during the pandemic, the glove manufacturing is become another trend of like business among the refugee community, and they went there and then they're trying to like make it like I'm trying to earn a daily wages. And I also can see there are the exploitation as well because of the lack of documents, and they are still underage. And then as we all know that some employer, they do not pay the full wage to the the minors. And then they say you are still young and you only can earn this amount, but they have to work the same things, but they earn very less. And these are the things that happen during the pandemic in our community. And another thing is like, for example, they do not have enough fund to transform, as I mentioned, that online learning environment. Just now, one of the speakers also mentioned about that we received, yes, some of the support from the UNHCR. That's one time is like around like I think 10 tablets for our learning center. We have more than 100 students. How can we like trying to share this device, right? We cannot go around one another. After years of like on and off like learning environments, we finally trying to like run the learning center in a person, and during that time we were very difficult to find the right locations, because before the pandemic we have a place, it's a church, local church. We are able to use the places, but they said during the pandemic they will not allow us to use the places anymore. So we have to find another place to run that like kind of like a hybrid learning style, and like a half day we trying to teach them in person, and then half day we trying to run in online classes, and due to the limited places. And another thing I would like to add up is what is worse here is the children, those who need the special care, and also in the report has mentioned like a children with a disability. And yes, the refugee learning centers do not have the facility or expertise to educate children who need a special care. And there was one case scenario. It's also related to the healthcare as well. But I can recall that it means that there's a family. There's a family, and they're one child, and then the parents, mothers and father, and then father passed away during the pandemic. And the moms was left with the special needs child. And the child is proof that he has a kind of the, we call it that, kind of like an attention deficit disorder. And also like it's a bit fall into the autism as well. So the child cannot like go to the conventional school. So they are looking for like the kind of like a special need learning center, but they couldn't find. And then when they find, there are some like a private learning center, but they are so expensive for them. They couldn't afford. So the child is now like almost like a 10 years old, and the hospital last visit is like in 1 month ago. I was with them together to the hospital, and then we do the kind of checkup, and the hospital and the professional encouraged us to place the child at the special learning center. But we said that we couldn't afford. Is there any other way? They said, sadly, not for the refugee, but if the child is a local, the child will have the disability card and they will be able to access free education for his or her. But because of the refugees, the status, the child was excluded from that kind of the policy. And it's very sad to see. And I also would like to mention a little bit more about the current conditions with those who are detained at the immigration deport camps. And according to the Malaysia Immigration DJ, and there were 17,634 migrants and refugees and asylum seekers in the camps as of 26 April 2022. Among that, there are 1,528 children are under the facility, and they are not access to education. There are no learning center at the camps. I mean, all the camps. So it's very sad to see that. And then the children are stay under the deportation camps, and they were not access to the educations. In the second part, I will also would like to make some recommendation for that as well. I'm just would like to highlight here is the problem, the issue that's happened. So when it's come to the healthcare, and I think our community member and children were highly infected by COVID-19, as I mentioned, due to the a living condition, the crowded places, and sharing one household with one family and another family members. And another problem that the children did not have any place to continue their physical exercise, a physical movement, and because they have to live in very small places, and they do not have any space where they can play around with their friends during the pandemic. I know there are, some of the park, but we were not allowed to go park, and we all have to live at home. And the houses, as I said, is a very, very small places. They even do not have, the living room to play around with their other friends. And they do not have any chance to socialize as well with their friends or to communicate with them. And they suffer not only here, the physical health. I also would like to mention here mental health. And after the post-pandemic, what I can see, there are some of the behavior that's from the student is they are a bit anti-socialized with the friends, and they don't want to share things with friends, things like that. And they are a bit aggressive toward their friends, and their tolerance, limit is lesser than before, and things like that. So I'm really, it's kind of the worrisome for the students, in their future, how they are going to cope. And also, I did not see any kind of a support, mental support for children. When it's come to mental health care, we always talk about for the adults, how to care our mental health. But when it's come to children, I haven't seen any specific program that targeted for the children for their mental health, So, yeah, I can finally say what I can conclude is that being as a refugee myself and with my community, what I can observe is during the pandemic, it was a nightmare for all of us, and yeah, luckily we survived. So the post-pandemic, what I would like to mention is we need kind of the solutions and the programs, how we can help the refugees, asylum seekers in Malaysia. Yeah, thank you so much.
Thank you, Mr. Joe, for your sharing and also for just highlighting a lot of very important issues. So not just with heightened dropout rates during the pandemic and exploitative practices in the workplace due to adolescents being underage workers, and more importantly in deportation camps, right? We have so many children there who have no access to education and healthcare. Now I would like to direct the next question to Mr. Keen. So as an international organization, what is the role of UNHCR in addressing the issue of access to education and healthcare faced by refugees and asylum-seeking children, and maybe especially during the pandemic?
Thanks, Gurjeen, and thanks to IDEAS and UNICEF for inviting us to be part of this and for this much needed initiative and report. I think the starting point maybe to answer your question about UNHCR's role is to back up a bit and remember that ensuring access to education and healthcare, these are things that are primarily the role of the state, right, of the government. These are basic human rights that a state is responsible for upholding for all individuals on its territory, not just looking at kind of international human rights law going back decades, but also this has been affirmed going forward, including by Malaysia, in pursuit of the SDGs, SDG 3 and 4 in the case of education and healthcare. And that makes sense because UNHCR is not an education or health agency. We and UNICEF, for that matter, will never have the same expertise or capacity or resources as the Ministry of Education or the Ministry of Health. And so the ultimate goal, and really the only sustainable approach, is for the government to include refugee children in its national education and health systems. And really, this is our goal everywhere we work, right? It's to enable states to take responsibility for managing refugees and where we can minimize our role if possible. Now, that will, of course, require some kind of legal status for refugees, some kind of legal framework, enabling their access to basic rights. And the report rightfully highlights this underlying issue. It's something we continuously advocate for, and the report, I think, will be a useful advocacy tool for that. And we understand the government is considering some kind of framework. But in the meantime, we work with partners like IDEAS, like UNICEF, but also a host of other NGOs and refugee communities to expand refugee children's access to healthcare, to education, even in the absence of a legal framework, right? And what we appreciate about, I think, this report is that its recommendations are pretty immediately actionable. They don't necessarily require waiting for the legal framework to be in place. When it comes to education, as the report notes, we do work with NGOs and refugee communities to support this network of informal ALCs. And they are doing, the very best they can with the very limited resources to provide some kind of education. And others have already pointed out even this informal education only reaches a minority of refugee kids. So part of our role, and we hope, we'll have many joining us from this group, is to continue advocating for refugee children to be included in the national education system. But then another part, while we wait for that, is to mobilize support. And of course, financial support is obviously key, and that was a huge challenge during the pandemic. We would be happy to work with all of you to pool our efforts to raise funds for ALCs. But other than financial support, we also want to make sure that ALCs can operate without fear of being shut down by the authorities, right? And so we do have some role to play here, in that we do issue these protection letters to ALCs to explain that they are serving persons of concern to UNHCR. But more importantly, and again, the more sustainable approach will be to have them registered and recognized by the Ministry of Education much more officially. Yeah, and I think, as the report points out, all these challenges were exacerbated during the pandemic, especially financial challenges. But there was a silver lining, I think, in the form of online education. And I know Jaw said this was not easy to roll out, of course. But once it was rolled out, we did realize that it was reaching children, and I think parents, maybe more importantly, who weren't previously enrolled or engaged with some of these ALCs, including girls and their parents, as the report notes. And so as we've come out of the pandemic, for example, ALCs have been adopting hybrid learning modalities that have been able to keep them maintaining their enrollment rates despite some of these financial challenges. So something we can, I think, build on. I'll just quickly turn to healthcare as well. And obviously, COVID was a healthcare crisis for refugees, as was for everybody else. And our role, again, here was not as a direct service provider, but to really coordinate and mobilize healthcare support. And that's partly through the network of NGOs, NGO clinics that has been mentioned, making sure there are referrals and assistance for secondary care, and trying to highlight and find resources for some of those neglected health issues like sexual and reproductive health or mental health, which, as we've heard again, have worsened during the pandemic. So in addition to our advocacy at the federal level for broad, more inclusive policies, we also engage with local hospitals, local social welfare authorities, to make sure their services are available to refugees, especially refugee children. But of course, this was challenging during the pandemic due to some of the xenophobia that flared up. Again, there was a silver lining to the pandemic when it comes to healthcare in terms of the inclusion of refugees in the national vaccination campaign. And we like to think that that has reinforced the importance of inclusion, especially when it comes to public health, and how including everybody benefits everybody, and really no one is safe until we're all safe. And so coming out of the pandemic, we have seen positive statements from the government, including the Prime Minister recently saying that refugees are among the vulnerable groups in Malaysia that must be protected from manipulation, neglect, and abuse. And so our role here, again, one that we hope will join with many of you on, is building on that momentum and continuing our advocacy for refugee children. And so we do really appreciate the publication of this report, and we thank you again for all the work that went into it.
For this, the role of the UNHCR in addressing these issues, and then we're calling on various stakeholders that we don't have to wait to have a legal framework, even though that's of a huge priority, but we don't have to wait for a legal framework to actually start taking action and start implementing certain programs. Now I would like to pass the time to Ms. Najiha from Suhakam to share a little bit about what is Suhakam's view on the protection of refugee and asylum-seeking children's rights to education and healthcare.
Hi, first of all, allow me to extend my thanks to the EU, IDEAS, and UNICEF for providing us this platform. So basically, I think in looking at education and healthcare for refugee children specifically, Suhakam and OCC, the Office of the Children's Commissioner within Suhakam, we're open to further engagement with various stakeholders on furthering these rights. And of course, we agree with everything that Ken mentioned about, tackling the broader issue of legal framework and recognition, and whilst pursuing that, also looking into the specifics of what's going on currently on the ground as well. But maybe I could highlight some of Suhakam's statutory rules so that we can be clear and see where the opportunities are for collaboration, especially in implementing the suggestions within the report that was so comprehensively prepared. We are a statutory body in charge of human rights in Malaysia, and our statutory rules are within Section 4 of the Act. But broadly, if I could just classify in broad terms, OCC's work is divided into three, which is the legal and policy part with some advocacy underpinnings, as well as education and promotion, where we try to shake up the narrative that, or attempt to shake up the narrative that broader society as well as maybe enforcement officers have towards the refugee community. Our third role is in terms of complaints and monitoring, where we are empowered by statute to go into immigration detention centers to look into how refugees issues there, and also to entertain specific complaints by either NGOs or individual refugees in terms of right violations. Currently, if I could just highlight some of the potential areas, back in, I believe, 2021, we had a survey, we conducted a survey actually involving 7,332 students. And this was through our Children's Consultative Council, which also consisted of some refugee children, where participants, 9% of the 7,000, they were actually children in ALCs. We don't know the exact background, breakdown in terms of the percentage of refugee children, but all in all, the results said that they really did struggle during the pandemic, with 56%, which is more than half, saying that they found online learning not effective, and 32% saying that they felt lonely and unmotivated, and then that 29% said they were anxious and felt like they couldn't catch up their schoolwork. So this is just one perhaps potential area we could do studies like this to feed into further policy work, and to try to lobby the government, especially in light of their Article 22 obligation to the CRC to also protect, ensure that refugee children are also entitled to the same rights as others. And in terms of our work, in terms of child protection and healthcare, what we have seen as an issue within that area is the fact that during the pandemic, SCAN teams weren't really operational. So suspected child abuse and neglect, they need specific management. So typically what will happen is that the social welfare department, social workers, child protection officers, in addition to doctors and the PDRM, will come in and to assist and to figure out how best to support the child victim. But what we saw is that this didn't happen during the pandemic. There was some these regular scam meetings didn't happen. So a lot of it just, including some refugee cases which we have received, that just fell through the cracks, and which unfortunately some of them have been left sort of unaddressed. So it's something that we try to investigate if we do receive a report on it, and try to monitor. And we do hope that with contribution from various stakeholders, we can try to improve this. I suppose that's it from me. Thank you.
Thank you, Najiha. Next, maybe we can hear a little bit from Dr. Aida. So based on your experience, especially with running Clinic Amal Muhajir, what do you think is the main barrier that hinders refugees and asylum seekers to accessing medical care? And maybe share a little bit about what your experience was like as a practitioner, especially during the pandemic. Dr. Aida, you are muted.
Sorry. Okay, so good morning, everyone, and thanks for this invite and this this study that you all have done. I think it's a very beneficial one that's going to be able to take leaps and bounds in all the recommendations. So, I mean, in answer to your question, I think, first of all, access to healthcare has been challenging to the refugees even before COVID-19, you know, especially for children, I think, because they are dependent on the state of their parents, you know, whether the parents are legal, whether they dare to venture out, or whether they have the finances to seek treatment. So, and as you know, most NGOs, we only offer primary care. So the moment there are referrals to secondary, it's usually not seen through due to the financial reasons. And again, of course, due to financial fear of detention. Having said that, the access to healthcare was actually worse during the pandemic. And I think for obvious reasons, due to the overload in the public hospitals. So I think it was a very difficult and trying time, not only for the refugees, but also for the locals, I think, in terms of healthcare access. But back to the refugee children, they are obviously, as I said, dependent on the parents. And as you all know, there was a very high level of xenophobia. Everybody mentioned that during the time of COVID, and putting yourself out there in the open was actually a very high risk in terms of security. You know, where there's problems of being caught, or, you know, bribery was involved. And even if you're a documented migrant, actually, it doesn't mean that you're safe just because you are documented. I've had many patients who were stopped on the way to the hospital despite having documentations. But the issues are also always the same, and it's in line with your study, actually. There is always delayed presentation due to financial and security reasons. Because their resources are so scarce and limited, health becomes a secondary matter. So that's a problem. It's always survival first. So delayed presentation is almost a norm in this community, unfortunately. I mean, how many times have you heard of you know, a child being admitted to intensive care for something as simple as gastroenteritis, right? It's just that they wait for the last moment because they cannot afford it, and also because of the risk. Of course, we can put it down to lack of awareness. It's also in your study. But personally, in my experience, finance and worry of detention tops the list. As for us, the medical practitioner, yeah, there were a lot of problems. And I think one of the main issues as well was the problem of stigma, which actually caused the patients to hide their symptoms from us, you know, during the screening processes. So sometimes it puts us in a very high-risk situation, especially when most of my staff are volunteers. You know, we have volunteer medical students, volunteer pharmacists, volunteer doctors. So it was high risk and a little bit unfair to them. But the refugees run into a very, you know, they have risk of social isolation. They get even turned out of their flats, even if they are, you know, slightly associated with anything to do with COVID-19 sometimes. So, you cannot blame them for this because of the stigma that's associated with that. We also had issues in sending them medicines for those who are quarantined. And I have to thank Lala Move, because they took us, I mean, we were their CSR, and they provided us free services for medicine service delivery. I have to mention that. They're still doing that until today. We also had a problem of referrals, as many of them don't want to go to the hospitals for the same reasons: finances, they weren't treated very well, there was risk of being detention. And so actually what we did is we ended up creating a WhatsApp group with every single COVID patient or any possible patient with symptoms. And we provided them with pulse oximeter and had a, you know, like every day have them check in with us. And yeah, it was a very interesting time that time. But it was a huge challenge because we were just starting out and we really had no idea what to expect. So as my friend said, it was a bit suicidal, starting a charity clinic in the middle of pandemic. But I thought that was really important for us to do. And I think we did managed to help as many people as possible around that area at that time. Thanks.
Thank you, Dr. Aida, for just sharing with us some of your experiences on the ground. Now, I think I would like to move on with just for all of you panelists to share a little bit about, I think we had touched on this a little bit already, on what should we prioritize as a nation moving forward in order for us to ensure that refugees and asylum-seeking children are not left far behind for any longer. And I think there are some things that were touched on earlier were issues like the lack of legal framework, right? And also issues such as just we have some programs that are being implemented, but at the end of the day, I think sustainability of these programs are a big issue that we might need to address. And we talk a little bit about collaborations and partnerships among various stakeholders as well. So I will just pass on the floor to any panelists who would like to go first to share about what should we prioritize as a nation moving forward.
I can say something, but okay, so okay, I guess my focus is healthcare, obviously, but I feel that you really cannot differentiate the two. I mean, urgent action, I think, would be, as we all agree, is for the government. I mean, we need a top-down acknowledgement of the presence of these refugee children and their needs. You know, we need to acknowledge that their needs are just as similar as any other children in Malaysia or in the world, right? So they need to be supported in terms of education, to be able to have a future, you know, and grow up thinking they don't need to be a charity case the rest of their lives. So, but obviously education is just one element of total well-being. The other one, of course, is health. We all know that Malaysia is not a signatory of the 1951 Refugee Convention, but I think we cannot keep using that excuse. There needs to be a call for a multidimensional discussion, I think, between different ministries, MOH, MOE, Ministry of Home Affairs, Women's, Ministry of Women and Family Affairs, even Jabatan Agama and MOF. They need to get together and discuss the issue of refugee children as a whole. You know, this has to be the first step, because obviously this is not an issue that you can solve, I think, in silo. You know, you cannot do it on your own. And of course, addressing issues of healthcare access to refugee children, you won't be complete if you don't discuss their parents' access as well, right? I mean, currently we have that 50% hospital admission is a huge blessing. 50% discount for hospital admissions. But, you know, if you're not earning, you don't have a steady income, you're not allowed to work, even if you give a 90% discount, it's a burden. So I'm sure you all know, every time there is an admission or a refugee needing surgery, there will be requests for funding, requests for donations, because it's just not sustainable. So I think, again, it's wishful thinking, but I think the first step is still the ministry. So at least get their representatives to get together and discuss this and come up with a top-down solution for the refugee issues. I mean, we as NGOs can keep doing whatever we can at our levels, but, you know, to what end? And before I end, just one more issue. I think it's very important that we engage the media. You know, we need to promote a positive perception of refugees. You know, during pandemic and during the floods, I think there were many refugees who were assisting the locals in their cleaning, cooking, and doing their bits for our nation, for the locals. So we need the media to change its public perception so that it can actually be a drive to push for further policy changes that will benefit or at least not endanger the refugees in Malaysia. So this is my take on it. Thank you.
Thank you, Dr. Aida. Anyone would like to respond, to share your thoughts?
I can build on that. I think, certainly agree with the broader advocacy goals of getting the ministries involved, and that does have to be the priority. You know, the general inclusive policies, those are urgently needed, whether it's on education or healthcare. But I think also in the meantime, while we wait for those policy changes, there are some sort of actionable goals we can pursue. I know in the report it mentions, you know, increased resources or mobilizing resources for ALCs. That's obviously key, but when we do that, we can't forget that 70% of refugee children aren't even accessing ALCs. So when we talk about mobilizing resources, it needs to be directed towards expanding access, right? And making sure we capture more of those those kids who aren't having any kind of education opportunity. And then when it comes to healthcare, of course, reduced fees would be very important if that can come from the government. Something we're also trying to explore is a health insurance scheme, and that would address many problems. That's sort of part actionable, part advocacy, because insurance providers in theory can act without policy change, but they'll only do that if fees are lowered or if there's a legal framework in place to ensure that there's a large pool of insured refugees, right? Another, I think, urgent need on the policy front would be free vaccination for refugee children, and that, again, is in the report. When it comes to kind of immediately actionable priorities on healthcare, I think we do have room, especially for refugee children, because of the CRC, to sensitize hospital workers and social workers to the situation of refugees and explaining what support is available from us, from NGOs, and setting up some of these referral pathways to encourage the hospital workers and social workers to serve refugee children and make sure we don't have instances where they're turned away. And I think on both these fronts, on education and healthcare, there's a pretty strong case to be made to the government, to the other stakeholders, that these are win-win propositions for refugees and Malaysians, right? Because the more refugee kids we have in school, any type of school, the less likely they'll be vulnerable to exploitation, to those negative influences. And that's something that the foreign minister himself has pointed out. And then obviously, if all refugee kids are fully vaccinated, that reduces public health risks, not only for themselves, but for everyone in Malaysia. And that was, of course, the great lesson of COVID.
Job?
Yeah, can I go? All right, I totally agree with my fellow panelists and what they have mentioned. And also thank you so much for this comprehensive report as well. Those who has put a lot of your effort to come up with this comprehensive report. I really like it, all the recommendations. And as one of my panelists mentioned, one of my fellow panelists mentioned, that they are doable. So I also would like to come up with a few of my personal recommendation. So first of all, like to have the political will to have a legal framework for refugees. As we all know that all that issues are interrelated, like healthcare, education, employment, incomes, these are all interrelated. Without this legal framework, this problem will not solve. And the problem is like if the parents do not have that enough incomes and decent job to support the children's education or to seek medical health care. And yes, as Dr. Sidin already mentioned that, yeah, we are really grateful that government give us 50% discounts, but which is still a lot for us because we do not have that incomes to provide our children with that health screenings or medical health care that they need, because it's stay 50% from the foreigner rate, which is 10 times higher than the local rates. So I think, yes, having like a comprehensive legal framework for the refugee would solve a lot of issues. And another thing I would like to mention here is for the educations. For the education, I would like to request Malaysian government allow the refugee study at the formal school. We only can provide the informals, which will not last long. And then, as I said, it's under resources. We're really concerned about our refugee children's futures, what they will do after they graduate from our learning center, what they can do, and what they can pursue for their tertiary education. And yes, and there's one member also asked about the tertiary education. Yes, there are very limited places for tertiary education. From our center, we have the IGCSE until IGCSE. The 6 now is already like 11 students passed the IGCSE. Some of them did really well, but they do not have the chance what they want to pursue. Some of them want to go for science, but there's no science subject provided for refugee in Malaysia. Only the art you can go because you're a refugee. So these are the things that we have to look into, and government have to come up with more comprehensive approach, regardless of immigration status, what I would like to call this. And then, yes, only the formal educations will allow refugee, keep them away from the cycle of poverty. So let us try to be the change maker, and let's keep on doing the advocacy work to have a betterment of right for refugee in Malaysia. Thank you.
And if I could just add to that, I totally agree with all the three fellow panelists, but I am particularly interested in what Dr. Mentioned earlier about mobilizing the media to shake up the narratives that people have towards refugees. One of the key barriers that we face in our advocacy work is in engaging the government and advising them on the international obligations and things like accession to the Refugee Convention is the narrative. So the perception is always, or the argument is always public security, is always the fact that Malaysians first, but and I think with enough mobilization of the media, with the correct narrative, we can perhaps slowly change and eat away at that perception within our leaders' minds on refugees and to push towards or steer towards policy change. So yeah, I think that's a really necessary thing. Mobilizing the media, we can't underemphasize on the importance of that, as much as we think that, you know, like there are bigger solutions out there. And I think also I am also interested in the issue of primarily the most important thing is the right to work, because everything else right now hinges on the right of the parents of these children to work. And it's true. I think IDEAS themselves did a report for us, I think in 2019, on the potential or the contribution that the refugee community can have to Malaysia's GDP. So actually, I mean, to us, it's such easy logic. We can, it's a win-win situation really to the governments and their pursuit of like better economy, and also to the rights of refugees. So yeah, like Dr. said, you can't really separate between, you can't separate children and the rights of refugee children from their parents, because as much as we want to say that, well, we've taken back our reservations on Article 22 of the CRC, we now have obligations to protect our refugee children, but still the core issue of family, the core issue of parents is something that we need to look into as well in mobilizing this. So definitely think that all the recommendations made by the three panelists are something worth looking into and pursuing together.
Thank you, Jo and Najibah. I think just to echo the panelists and just to kind of sum up, really some of the things that have been emphasized is the whole aspect of the need for the government ministries to take responsibility about this issue and to start talking about not just refugee children's access to education and healthcare, but just refugees' rights in general, right? And a step for us to advocate for that and to push for more political will, like Jo mentioned earlier, is one way is the media, right? The media plays a really important role in changing the narrative surrounding refugees at the moment in Malaysia, you know, changing the narrative of public security to, you know, just caring and discussing about refugee rights issues fundamentally because they are a member of our society. And I think this really helps to not just shift the narrative among the government ministries, but to a certain extent to the general public as well. So I think that has been emphasized quite a lot in the panel discussion. I think we have some questions now, so I would like to go into some of the questions that were asked by the audience. The first question was regarding tertiary education, which I think was briefly talked about earlier. So we all know that, you know, tertiary education, like what Jo has mentioned, a lot of the refugee students, they finish IGCSEs and they find it difficult to continue on to tertiary education after that. So what are some of the tertiary education options for refugee youth in Malaysia at the moment? And I think for you yourself, you are currently pursuing law, so maybe you can share for your personal experience.
Thank you. And currently, yes, only there's, I think, the 1, 2, 3 institutes that allow refugees to study. And in the 2000s, I think around 17 or 16, I really can't remember the date, but there were a few institutions that has MOU with the UNHCR. But the first time I applied my law degree at HELP, but the HELP, because of my legal status, my immigration status, they said only refugee. So here is a bit technical issue as well, I would say that. So if a person is recognized refugee and asylum seeker, stay different. I have the UNHCR card, but I'm the under asylum seeker. Because of this, my technical status, they do not allow me to study. And then my program was deferred. Then I quit from that, and then I had to apply at BAC for my law program. So like even I have completed my high school and I was a university student in Myanmar, but because of my country education systems and to a transfer here is they are not allowed. So I have to wait for like to continue my tertiary education. I fled from Myanmar in 2012, and then I arrived in 2012 in Malaysia. Have to wait for like 5 to 6 years to continue my tertiary education in Malaysia. It's not easy. But now, like the BAC is a bit open up for the students who would like to pursue like tertiary education. Yes, the institution did quite well, I would say that, because they give the special discounts for the refugee students, and then they allow the refugee to pursue their A-level and then other foundation classes. But the sadly is, as I mentioned, there's no institution has provided science courses for the refugee in Malaysia. There are some of my students, I'm teacher at the learning center. So some of my students, they said they would like to be a pharmacist, and they would like to be a doctor, and they would like to be like a kind of like a biologist, things like that. When it's come to related to science, there are no space for them. There is no space for them. So they could not continue their dreams, their education, what they want to be. But here, what they can do is only like to complete their A-level or foundation class and to continue with other art class. But I'm really grateful that the art side is stay open for us, so we still can continue the education. But the barriers are, yes, tuition fees are so expensive. Let's say as a volunteer teacher, we earn only like compensations a month, like 1,000 ringgit per month, and then like our tuition fee is more than 1,000 ringgit per month. So how we can afford that? And then the same thing is go to other refugee students in Malaysia as well. So I think we need more like a scholarship program for refugee students in order to pursue their tertiary education. They are the complementary pathway, but I have just recently saw one news that the 5 Rohingya youths are resettled to the Philippines to pursue their tertiary education. I think these are kind of like very encouraging the refugee to pursue their education, but should not only like targeted for only one group, and it should be like including for all the groups. The opportunity should be for all, not for one group. Yeah, that's what I wanted to emphasize. Thank you.
Can I also just invite the presenters as well to join our Q&A discussion, and maybe if Yashin, you would like to weigh in on this question about tertiary education for refugee youth in Malaysia.
Thank you, Kajin. Yeah, I think Mr. Joe has highlighted quite comprehensive because due to his own experience. From what we understand is that refugee children could not go to public universities for sure, because one is due to their refugee status. The second is certification. It's not recognized. So also coming back to the question that, what we understand is that some ALCs choose to go for ICGSE so that they can get a certification. But for those who, and it's a more costly curriculum rather than the Malaysia curriculum. So some ALCs could not afford it. So they opted for the Malaysia curriculum. What happened is that they could not get a certification, even if they have finished the syllabus. So one of the recommendations why this is put in place is that to allow them to participate as a different, as a foreigner in SPM, that would help to at least they can get a certification of their education. So that is one thing. What we see so far, maybe another open opportunity is on online universities that I see that you can access to around the world. There are also scholarships available specifically for refugees. Of course, it's very competitive. What we understand, I think one of the things that we need to remember is how the limitation actually caused a lot of demotivation among the refugees. They felt rejected. They felt like there's no hope. Even if I finished education, what's the point of that? I can't progress to have to go for higher education. Neither could I secure a decent work. I think that really is a point that we need to look into and ensure that they could have progression and access to what is to come in the future. Yeah, so that is, and maybe can I just touch on some of the points that the panelists has mentioned? I think on the recommendation, yes, I think, thank you for highlighting it, because how we felt is that we wanted to put in more implementable recommendations rather than in the long term. And it's not to say that that's not important. I think that is the objective, the policy framework, the legal framework to come in. But what can we do while waiting for the framework? So I think that's what the report tries to bring about. And at the end of the day, every child should not be deprived of accessing basic services in the country, education and healthcare. Every child should have access to it. And we should provide education and healthcare to the refugee and asylum-seeking communities, regardless of what their status is, regardless of their nationality, even if they are undocumented. I think we should still provide these basic services to them.
Thank you, Yashin, and thank you, Jo, for weighing in on that question. I have another question from the audience. My apologies if we don't have the time to address everything. So I think the next question is, Malaysia is yet to sign up to the United Nations 1951 Refugee Convention and its 1967 Protocol, and it has no legal or administrative framework for dealing with refugees. The state has been hosting refugees based on humanitarianism on a case-by-case basis. Now, how does Malaysia overcome on issues of refugees, even not being the member of the convention? If anyone would like to weigh in on this question.
Sure, I'm happy to weigh in. I mean, I think it's important to remember, especially when it comes to children, and given the application of the CRC in Malaysia, that the rights we're talking about, especially education and healthcare, these are universal rights, right? And they apply regardless of whether a country is party to the Refugee Convention. And in many other countries that host large numbers of refugees, even though they're not party to the convention, they still grant access to free education and free healthcare for refugees, especially for children. So the fact that Malaysia is not party to the Refugee Convention by no means precludes it from offering or from being obligated to provide these rights to children.
Anyone else would like to respond to that? Maybe Dr. Drita?
No, sorry, I think I'll pass on this one. But if there are any questions on the healthcare bit, I'm happy to chip in. Thank you.
Yeah, but if I could just chip in, like Keen said, there's no, of course, when you become signatory to or you accede to a convention, then what comes with it is international obligation to abide by those the provisions within the convention, and also possibly international support from the international organization with purview over state treaty. Like we have UNICEF working on children's issues and the implementation of CRC in Malaysia. So certainly implementation comes with its benefits, but also I think the government's fear is that it would be held accountable internationally by these obligations. But yeah, like Keen said, there's no barrier actually in ensuring that or in providing access for children and to education and healthcare. And as I pointed out earlier, the Refugee Convention, I think, is the core convention that we have to look into when we were talking about child, because again, after the fact that we can alienate or detach the concept of refugee children and their parents' rights as well. But at the same time, we are party to the CRC. We are obliged to provide all humanitarian rights that are accessible to us, everyday citizens, to refugees and asylum seekers as well. So there is a persisting, existing obligation, international obligation already in Malaysia, and the 1951 Refugee Convention aside, there are solutions that can be undertaken, like what's been proposed in the report, for us to meet our Article 22 obligations. Thanks.
Thank you. We are running a little bit over time, but I think we can take maybe another one question from the audience. Someone mentioned that Myanmar people are becoming more and more undocumented because of the situation in Myanmar. And the main challenge is access to healthcare. And due to not having proper document once they are in hospital, they are also being discriminated and threatened, and are also asked to deposit a huge sum of money before being able to receive treatment. Are there any ways, maybe for people who are tuning in here, are there any ways that we can help these refugees and asylum seekers when it comes to access to healthcare?
If I may refer to the recommendations highlighted by the report itself, of course, there are many different ways of going about it, but I think the main issue here is on legality and also policies. So again, the authors of the paper, of the report, emphasize that there needs to be a removal or to reduce non-citizen fees at government hospitals. There needs to be the implementation of health insurance or finding ways of healthcare financing. Obviously, the MOH circular number 10 is also seen as a barrier to access to healthcare for targeted groups. There needs to also be establishment of a policy looking at firewalls between service providers and also immigration authorities. So these are, again, what have been highlighted, but I'm sure for the NGOs on the ground, there can be more collaboration and more support from the ground up as well. I hope that has answered your question to a certain extent. Thank you.
Can I just, I'm sorry, can I just add to that? So I think there's also, so there's one issue I probably need to mention here because of the fact that he's undocumented. I think UNHCR is having a lot of backlog of getting the process of documenting refugees. I find that a lot of, I think I was told by UNHCR themselves, I mean, Ken can confirm it, due to COVID and all that, there's a lot of backlog. So a lot of patients, a lot of refugees are walking around are still asylum seekers level. But at the same time, for patients who require urgent admission to the hospitals, UNHCR has got a process of applying for an urgent UNHCR protection letter, providing the card early, which you can apply. We usually apply as a clinic through to any UNHCR. I'm not sure if your clinic can help do the same as well. And so that's regarding documentation. But the other thing is that there are many organizations that do help with funding and assisting in terms of surgeries and stuff like that, which you can try and contact either IMARED or Zuchi. These are organizations that can look into assisting REF, sorry. Yeah. So there are many organizations. So you need to find out from your community leader who can help you out. Okay, thank you.
Thank you so much. Any final comments with regards to that question?
I just would like to add some things there. Just now, Kenny also mentioned about having as a refugee, from the refugee perspective. What I would like to request is that here the solution is to have the health insurance is very important. And then I think there were like a 2017-18, there was a remedy, the health insurance, which is a lot helpful for the refugee. When they would like to admit at the government hospital, they just have to show their insurance card and they can admit straight away. Now, yeah, you have to prepare to go to hospital per month, at least 5,000 ringgit for like a, that if you want to be an in-person, inpatients, you have to prepare the 5,000 ringgit at least. You have to go there. And then that's a lot of like a fee, other fees. And then another thing is also language barrier. So, and yeah, there's non-doctor, CDN, Norita also mentioned that expedited registration, but it's also state dependent on your case. So like not everyone received the expedited registrations. It's also dependent on your case. So it's a lot more difficult. I think also here, what we need is awareness training, healthcare training from the NGO, INGO for the refugee community to be more aware of their, healthcare, and then, in their daily life, how the way they should live and what other food they should eat, things like that. Yes, I know it's not easy for refugees keeping up on the standard living because they are lower wages. That's why they couldn't keep it the standard living. But from that scratch, what we can do is how they can stay continue to pursue their healthy life. It's also very important. Thank you.
Thank you so much to all panelists and also presenters for weighing in on this Q&A. And my apologies if we do not have the time to address all of the questions that were asked. Again, I would like to pass the time now to Dr. Juwita to deliver her closing remarks.
Thank you, Kirjane. Thank you, ladies and gentlemen, for your kind attention and contribution in the discussion. So we've seen that this report highlighted that there are many pre-existing barriers to education by refugees and also asylum-seeking children, which has worsened during the pandemic. So these barriers include poverty, lack of awareness of the importance of education, geographical barriers, and also the lack of financial resources faced by ALCs. From the healthcare focus, we saw that the report highlighted that among refugee and asylum-seeking children, issues including poor hygiene conditions, low parental health literacy, and malnutrition were perceived to be the main causes of morbidity that have significantly worsened during the pandemic. So given the issues discussed and also examined, we see that there needs to be a mixture of both top-down and bottom-up approaches related to legal issues and creation of timely programs catered to the target audience. Just as a last note, as Malaysia is committed to the SDG 17 goals, access to healthcare and also access to education need to be improved upon to include non-Malaysians residing in Malaysia. Only by taking care of everyone in Malaysia can we achieve the targets of the SDG 17 vision in the medium to long term. Thank you and have a great and wonderful day.
Thank you so much, Dr. Juwita, for your closing remarks. So with that, on behalf of IDEAS and UNICEF, we would like to express our sincere appreciation to our distinguished speakers, our presenters, our panelists, as well as our participants, and also the European Union for making this webinar possible. So if you would like to look more into our full report, you can actually head on to IDEAS website, and I believe the link is also in the chat box. You can download the report. We also have published an audiobook summarizing some of the key findings of this report in Rohingya language. So if you know anyone who might benefit from this, feel free to disseminate it out. If you would like to share this webinar actually is recorded and will be posted as well. So again, thank you so much for your time, and we really look forward to meeting you in our future events. Thank you all. Goodbye.